So welcome to Lunch Break. If you are new, we have these lectures on the last Tuesday of every month over the noon hour, and it's intended to be a bit of a lunch and learn session so that you can come and join in and participate with some of your fellow colleagues in the Christmas tree industry and also get a sense of what we're up to as the technical team here. So these lunch break sessions, we do have live sessions, which you found your way into now. So these are over the Zoom webinar platform. I usually set it up as a meeting so that everybody can turn their video on and participate, as you can see today. As I mentioned before, they're always from noon to 1, last Tuesday every month. If you want to get on the mailing list, you can email Brittany at the Christmas Tree Council. Her email is outreach@ctcns.com. Or chances are you can probably find an ad before the session starts. Like yesterday, I think there was an ad that went through our Facebook. Sometimes we have LinkedIn ads. They're always in the Christmas Tree Journal, that type of thing. And something new that we've been trying is the pre-registration link. So if you do see it early on and you want to go in and pre-register, then you have the opportunity to do that. And it should send you an email with the details to log in. So if you aren't able to make our live sessions, like some of you have here today, we do record all of our sessions and post them to our YouTube channel, which is where we usually get a lot more traffic as well, because you can watch them at your own leisure. Our YouTube channel is just Christmas Tree Council of NS. If you just Google that, it will pop right up where I've provided the link there. Another option that we have, we are taking the audio out of all of these technical sessions and putting them into our podcast, which is called Real Trees, Real Talk. There's some grower experience sessions on there where we just have some guys telling us stories. And then there's also all of our technical webinar sessions if you like to listen to podcasts. And you can find that on any of the regular podcast platforms. It's on Apple Podcasts, it's on Spotify. It is on Anchor if you want to go through your actual web browser, and it's just called Real Trees, Real Talk. So with that said, today's session is a little bit different. Like I mentioned, not as technical, but equally as important. So we're going to be talking a little bit about mental health and basically avoiding that seasonal burnout that we get after a really hard season of treeing. So we have a guest with us today, Jill Chappell, and she is the Marketing and Communications Lead for the Mental Health Foundation of Nova Scotia. And she's going to talk to us a little bit about mental health in the workplace. So I'm going to stop sharing my screen. I'll hand it over to Jill. And I believe if you do want to ask Jill any questions during her presentation, you can just type into the chat box or raise your hand and she'll get to them when she gets a chance. So thank you very much for joining us, Jill. I'm going to hand it over to you.
Thanks so much, Jay. Thanks for having me and joining you today. This is fun for me because often when I get to do these presentations, it's very much a corporate environment. So it's been a little challenge for me to try to navigate, change some of our messaging and make it a little bit more I guess, appropriate for you. So I do hope that I've been able to do that well. And if you have any questions, please don't hesitate to ask. I know that sometimes talking about mental health isn't always the easiest thing. So I commend you for joining us on this lunch break to do that. And you can always send me questions. If you have questions that you don't feel comfortable asking in front of your colleagues, you can always send them to me and I'll provide you with my email so you can reach me later. Okay, so just to start, very timely topic, mental health. I'm sure you've heard a lot of people talking about it. And given the challenges that we've all faced throughout the past year, it's really never been more important to take care of your mental health. Fortunately, we have vaccines on the horizon, but building resilience is also going to be really important in that regard as well, because there'll be even more changes to navigate as we kind of go back to normal or find another new normal. So today, what I'm going to do is we'll start with a brief overview. I like to know where I'm going when I'm in these presentations, so I'll just give you a quick rundown of what we're going to do. I'll tell you a little bit about the Mental Health Foundation of Nova Scotia, who we are and what we do. We'll take a look at the current state of mental health in our province and look at the economic impact of mental illness and how that can impact your workplace and your productivity or how it does right across the country. And then we're going to get into a little bit more general look at mental health, talk about some language, because that's really important part of getting the conversation started. If you have to have conversations with your colleagues or your employees, we'll look at what's called the mental health continuum, and then we'll get into more detail on burnout and prevention and self-care. All right, so as we mentioned earlier, I'm from the Mental Health Foundation of Nova Scotia, and we are a fundraising body, a registered charity, and our mission is to increase financial support to community initiatives that provide hope and eradicate the stigma surrounding mental illness and addiction. So our vision is that Nova Scotians who are living with mental illness and addiction are thriving in their own communities, and they have what they need to be able to do that. So essentially what we do is we fund programs that are based in the community that help fill in the gaps in mental health care and reduce barriers to supports and services. We are a very small but mighty team. There's just 7 of us, and we're fundraising professionals. And last year we were able to distribute a record-breaking $1 million to mental health initiatives throughout Nova Scotia. And I'm happy to report that we're just about to distribute another 1.2 million, and that will be our first round of community grants that we distribute this year. So that being said, there is more demand for services than ever before. So prior to the pandemic, when we talked about mental illness and the prevalence in our province, we would say that there was 1 in 5 Nova Scotians were living with mental illness. Well, that has increased since the pandemic. There are reports from the most recent study done by the Mental Health Research Canada body, and they've been doing periodic studies throughout the pandemic. So right now, 1 in 4 Nova Scotians are currently living with mental illness and addiction, and it's on the rise. So other findings from this most recent report are that Nova Scotians are seeing record levels of anxiety and depression, and they're increasingly turning to drugs and alcohol to cope. This year at the foundation, we've also anecdotally noticed a huge difference in the requests for funding that we're receiving. So this year, totaling 2.6 million. And that's the largest amount we've ever seen. And fortunately, we're able to fund half of those funding requests, but there's much more that that needs to be done to, sorry, I skipped ahead there, to increase, I guess, access to care throughout the province. The good news is there's hope. So you may have heard last week, the provincial government announced that they're going to be investing $19.2 million into mental health and addictions throughout the province. So those are the programs that are right in the hospital, but they're looking at creating what would they call regional hubs. So that would allow people to walk into the hospital or into these hubs and get same day access to care or without a referral. So you may have heard from a lot of people that is their biggest challenge right now. Is if they're in a mental health crisis, they may go to the ER and then wait for a very long time because they're, when they're triaged, it's not necessarily deemed as urgent as some other situations. So while the provincial government is working really hard to make changes, we're also working to help on the outside and fill in some of those gaps that are missing. So there's hope. If you need help, don't worry. It is available. Sometimes it's trickier to track down than it should be, but it is getting better. So moving ahead, a little bit more about the community organizations and the programs that we fund. Those are the organizations that I would say that are helping to fill in those gaps in care and making sure that people have access to supports and services right at the ground level. So in communities right across the province, from Yarmouth all the way through to Whitney Pier, there are different small grassroots organizations that provide support. So if you're looking for support in your own community, it is there. And we fund a number of these organizations. So within the hospital, we do fund we do fund programs, I should say, as well, inpatient programs. So you'll see the picture there of the garden on my left. That's the Common Roots Urban Garden, and that's one of the projects that we fund, and it provides horticultural therapy for inpatients at the Nova Scotia Hospital. It's also open to staff and community members, and it's a really good opportunity for them to get outside and to just experience nature, develop some skills, and I'm sure you all understand the benefits and the value of being outdoors and in nature. On the community side of things, we do fund, as I said, organizations throughout the community. So the Canadian Mental Health Association is a really good example of one of the organizations that we fund. And this picture in the middle here of these three women together, they're all regular participants at the Mental Health Community Coffee House, which is a place that they can go to play music, to listen to music, and to connect with other people who also have similar lived experience. So it's been an excellent source of peer support. Even throughout the pandemic, they've been able to adjust and have, you know, a Zoom style community coffee house, so people still have that support system that they need. And just another avenue example of how we help with the Mental Health Foundation, we also have what we call named grants. And individuals or organizations can basically provide funding to create these grants. And the one I have here as an example is called Swanee's Challenge. And it was a memorial grant that was created in memory of a young man named Jonathan David Cosman, who lost his life as a result of addiction. And his family has put together this program, and it's called Swanee's Challenge, and it's a multi-day adventure therapy program where they get to go hiking, and they are guided by counselors and really have an opportunity to connect with others, to develop a support system, and just see what they're made of, and really have an opportunity to connect with different activities and learn the value of leisure. So moving on a little bit more about myself, I think opening up a conversation about mental health, it helps if you open up yourself. So before I started working at the foundation, I was an anchor and producer at Global Halifax, and I worked on the morning news. And I loved that job. It was fast paced, it was busy, it was demanding. I didn't even mind those 3 a.m. wake ups. I'm sure if there's farmers in the community, you know what those morning wake ups can be like. And then I had twins, and everything changed. My life looked a little bit more like this. And while I loved being a mother, I just found that adjusting to motherhood and parenthood was much more challenging than I anticipated. Not just because I was caring for twins, but because I was living with postpartum mental illness. And I didn't actually know, probably for about a year and a half into their life, that's what was going on. So I found that everything wasn't just twice as hard, it was completely overwhelming. I was struggling to get out of bed in the morning just to complete basic daily tasks like, you know, getting meals organized, managing my emotions. And when I got back to work after my mat leave, I really couldn't keep up. I was showing up late for work. I couldn't keep up. And I really started to feel hopeless. Eventually, I hit a breaking point, and I made the decision to leave my job so that I could focus on improving my mental health. So many family doctors visits, counseling sessions, medication adjustments. Months later, I developed a better understanding of what it's like to live with mental illness, in my case, anxiety and depression, and a little bit of PTSD. And you know, it's really learning how to live with it and thrive and you know, and manage your health. And I think that's going to relate back to what you all experience when you go through burnout, because burnout and mental illness are one and the same. And you know, it takes a lot of preventative measures and lifestyle adjustments to make sure that you're living well. So that's a little bit about my story. And when you consider how many other stories there are like that out there, it really is amazing that stigma still exists, but it does. And you really don't have to look that far to see it. Fortunately, though, as people have become more comfortable, I would say over the past decade for sure, it's become much easier for people to get help. and feel comfortable talking about their own personal experiences. And that's what provides hope to others as well. So moving on, we're going to look at the cost of mental illness, because this comes down to the economy and also your productivity with your own businesses and at work. So if we take a look at the statistics, 500,000, that's how many Canadians miss work each week due to mental illness or a psychiatric issue. $51 billion is the estimated cost to our national economy on an annual basis. 1 in 3 is the ratio of workplace disability claims related to mental illness. And 70% is the percentage of disability costs attributed to mental illness. So the bottom line here is that it's very expensive, and we need to take responsibility for educating ourselves about mental wellness, mental illness, and addiction, and get comfortable talking about things like depression, PTSD, anxiety, suicide, self-harm, and just like we talk about, physical ailments, so whether it be diabetes or cancer, or arthritis, heart disease, we need to learn how to recognize the signs and symptoms of mental illness and know when it's time to ask for professional help. Nobody is immune, not fishermen, not broadcasters, CEOs, Christmas tree producers, parents, or children. Mental illness can affect us all. So what will it take to make a change? Well, to change mental illness, we have to all make a difference. So we have to work together to change the way people think, whether that be within our greater community or within our workplace, and work together to make our workplace and communities happier, healthier, and safer places where conversations can happen. And that is what will ultimately allow us to better identify when things are getting difficult, when we're seeing the signs of burnout, and being able to get on track before things get too far progressed. So some simple ways that we can start by sort of creating a more comfortable, safer workplace, a more comfortable space where conversations can happen and where we can be more comfortable talking about whether signs of mental illness are coming up or burnout, is by using proper language. So we'll start in very simply looking at a couple of different words that I'm sure you've heard. Mental distress, mental health problem, and then mental disorder or mental illness. So each of those really has a different definition. So looking at mental distress, it's just the common, expected, normal responses that we would have to stresses of everyday life. So, it may be, I was nervous about today's presentation, or having an argument with your husband or wife, or maybe your children, or failing at a task that you were hoping to complete. A mental health problem is a little bit more serious. That's a reaction that we would have to big life changes, such as a divorce or a breakup, maybe moving to a new homes, in some cases, even starting a new job. And these are serious problems. They can be quite substantial, and they can last a long period of time, but they aren't clinically diagnosed disorders, and they don't necessarily require treatment. However, a mental health problem, if it goes on too long, can then become, as we see on the bottom of the screen, a mental disorder or mental illness. So those are clinically diagnosed illnesses. You could have that and not be diagnosed. They do require evidence-based treatment that can be provided by properly trained healthcare providers. So that's when we say, major depressive disorder is one of my examples there, schizophrenia, bipolar disorder, generalized anxiety disorder, addiction, those would all be considered mental disorders or mental illnesses. So using that language to kind of differentiate between what it is you're experiencing or what it is your colleague or your employees experience, those words really help to be able to recognize the difference. Other forms of language that I think can help sort of just transform a little bit the environment that you're in. And these are things that, I catch myself saying all the time as well. But it's important just to note that, somebody else may hear that and not feel as comfortable being open about what it is they're experiencing. So if you're having a bad day, you aren't depressed, you're having a bad day. If you're nervous about today's presentation, you're having nerves, you don't have anxiety. Anxiety is a mental illness, or generalized anxiety, if we want the proper term. We like to use person first language. I'm sure you've heard this before as well. So she's not bipolar, she lives with bipolar disorder, or he lives with schizophrenia. The traffic was busy. The traffic was not crazy. It was not insane. Making proper words choices that maybe don't make people, don't put people off, that make people feel more comfortable. And a really important one, and one that I find myself correcting myself on all the time, is he died by suicide. He didn't commit a crime. He died by suicide as a result of living with mental illness and addiction. So changing our language is really just a very simple way to make a difference. In the comfort level, I think, about talking about this and within your community. So moving on, another great tool, the mental health continuum, and this would work really well if you're, again, trying to differentiate between how you're feeling and your mental health versus a mental illness, and maybe an easier way to talk about things without kind of labeling people or labeling signs and symptoms. So the mental health continuum really gives you a tool to look at describing anything from your mental health to that mental distress, mental health problem, mental illness, what we were talking about earlier. And we all have mental health. Everybody has mental health, and it can fluctuate depending on a variety of factors. So in your case, I'm sure it fluctuates on depending on the time of year it is, or leading into your busy season, during the busy season, and then after the busy season. So it helps to look at mental health on a continuum like this. So the mental health continuum model categorizes symptoms of good to poor mental health under a 4-color continuum. So green being healthy, yellow reacting, so orange injured, and then red would be ill. So you can kind of look at the different symptoms associated with those. So if you're really healthy, I know for me, that's where I'm feeling today: physically and socially active, performing well, limited or no alcohol or gambling. But if I think back to, April of last year, I would say I was definitely somewhere between the yellow and the orange, just concerned about everything that was going on, decreased social activity. We didn't really have a choice there. I definitely was picking up a beer quite more often than I used to, just, trying to settle the nerves, choosing an unhealthy way to sort of deal with all of the feelings that were coming up with the pandemic. But it's a really good tool for you to use to start a conversation, or to just kind of remove yourself from those labels and just talk about green, red, and anywhere in between. It also works really well as a stigma reduction tool because of that, because it removes the labels. So we'll move on a little bit. We're going to move on to burnout. I just wanted to note one more thing, is that if you look in the chat function right now, I did put a link there that will take you to the Mental Health Continuum self-check. And that's created by the Mental Health Commission of Canada. And it's a really good tool for you to kind of just look and see where you are right now. So you can go through and you can select the different symptoms and see where you lie. And it can also be a really good tool is if you have an employee or a colleague who you think is experiencing burnout or maybe some form of mental distress, to kind of look and see where they are. And, if they're at that point where they may need to focus a little bit more on their mental health, maybe, take a day off to get some rest, reassess some of their lifestyle choices that they're making to ensure that they're at their healthiest. So let's talk about burnout. So Jay had mentioned to me that burnout has been quite a challenge, and I can only imagine how busy you are in the lead up to Christmas. You may be familiar with, we have an event called the Festival of Trees, and that's our major fundraiser of the year. And we auction off designer Christmas trees. So I can say that I am a bit busier that time of year as well, because we're leading up to this event where we're trying to raise up to $250,000 or more. So I can identify with what it's like when you're kind of under that pressure of a timeline, and how difficult it is to manage that, because in some cases, you know, you do have to work those 12 to 14-hour days. You don't have a choice because it has to get done. But talking about burnout, for a long time, it was actually dismissed as just regular workplace stress, or in some cases, worse, a personal weakness of the employee. But in May 2019, it was actually classified in the International Classification of Diseases, and it's a legitimate occupational phenomenon. So the World Health Organization defines burnout as a syndrome that is the direct result of chronic workplace stress that has not been successfully managed. So it's characterized by 3 different things: feelings of energy depletion or exhaustion, increased mental distance from one's jobs, or feelings of negativity or cynicism related to your job, and finally, reduced professional efficacy. And I'm sure you can all identify with what that feels like. So the challenge is, how do we deal with this? And this is a challenge, I especially for seasonal workers. You know, I think part of it is recognizing that it's happening and recognizing it's real, and using the 4 stages to try to curb it as much as you can. So the 4 stages of burnout are as follows: enthusiasm. I think we all know what that feels like. That's the starting a new job, ready to take on the world kind of attitude. The second stage is stagnation. So things aren't going as planned and you're starting to really get bogged down in the detail. Then frustration sets in. The gap between what we plan to do and what we perceive we're actually doing gets wider. So you feel like you're not being effective, things are not able to get done, I can't figure out how to do this. And then finally, apathy. So that's when you're emotionally detached. You were once passionate about this job, and then now you just really are having a challenge finding meaning in your work, and fulfillment. And that is when you've hit that kind of rock bottom burnout. And it does take time to get back to the beginning. And, you know, it's hard, it's easier to stop things, I think, when you're halfway through that phase than you are when you get to the end. So being able to recognize the signs and symptoms of burnout, or when burnout is starting to set in, are really important. So, you know, physical and emotional exhaustion, I think that one's pretty obvious. Sleep disorders, are you having trouble getting to sleep at night? Are you having trouble staying asleep? Are you feeling like you're not feeling as confident about yourself? Your self-esteem is lowered, feeling helpless, like there's no way that you can get this done, having headaches. You might have like physical responses to the burnout. So headaches, stomach pain, nausea, you know, not feeling like eating, or, you know, increase in alcohol and drug use. You know, you need something to get through this, to make you feel better. And that's what you resort to. And in some really serious cases, suicidal thoughts. So burnout can be a very serious thing, and it can lead to even greater mental health problems and mental illness. So how do we prevent burnout? Well, you know, that is not a one-size-fits-all thing, but here are some things that I can advocate for you doing within your own workplace. So separate work and home. That is a real challenge, especially if you're, you know, if you're a producer and your farm is right there and everything is all integrated, or if you're somebody who works in an office, and most of us are still working from home. But it's very important for you to take uninterrupted time for your home life, for your family, and enjoy life outside of work. And also role model that to your staff and to your colleagues. It can also be beneficial to get everybody involved in wellness initiatives. So for example, this monthly webinar that you're having is really great. I know that that's not necessarily always wellness related, but that professional development side of things can really help to improve self-confidence, can make you more engaged in what you're doing, and feel a lot more engaged, I guess. So the next thing, keeping the lines of communication open. So you really want to make sure that you're regularly checking in with your employees, with your colleagues, with everybody within the greater community, and just making sure how everybody's doing. You're all going through the same thing at the same time. So being able to chat with one another and have honest conversations about how you're feeling, and being receptive to both negative and positive feedback. Monitoring workload and overtime. Again, super challenging. I know with seasonal workers, you're really trying to condense, probably what is a year's worth of work into a season. But we all have different capacity limits, and it's really important to recognize that. So while somebody may be able to work 12 to 14-hour days, 5 days in a row, and they can recover in like a day or two off and then get back into things, that's not going to work for somebody else. So again, we're going back to keeping those lines of communication open and really identifying what it is that works for you. And beware also of those employees who kind of go above and beyond, that may be working evenings and weekends, because again, those extra hours can really catch up. And then that's when you're going to get further along in those 4 stages of burnout that we talked about. Encourage time off. Well, I'm sure that is not necessarily something that you can take in the middle of your season. However, knowing that maybe you can take a couple hours here and there to get in that rest and relaxation, or being aware of the fact that, after this busy time, you have more time coming up, and setting that time aside to rest and relax and completely disconnect from the work, that will go a long way to making sure that you can recover from, probably some of the burnout that you will experience as a result of being a seasonal worker. Provide support and resources. So I'm sure you all have different sort of benefits within your employees, within your employee package or within your workplace. I'm not 100% sure what those are, but making sure that you are aware of what is available to you. So, are there, do you have access to EAP or counseling? If you don't, what are some other resources within the community? I can provide you with a list of some of the community organizations that I know that do provide support, so that people have somewhere to go if they are feeling more than burnout, if they live with mental illness and that they're finding that the busy time really ramps up their symptoms. Knowing that there is support there is a big thing, and not everybody doesn't always know where to find it. So if you as an employer or a manager can provide that support and resource, that will go a long way. And then finally, as I said earlier, embracing professional development. So I think there's a study that says like 60% of employees, choose to leave their job as a result of management. And that is because managers are human beings, and they can develop blind spots. So being aware of that, and recognizing that if you are a manager, that you could possibly be contributing to burnout, it's important to recognize that and at least just be aware. And knowing that you can also experience mental fatigue and burnout yourself. So it's important that you're genuine, that you remain open, that you observe as well and listen, so that you can recognize if the people around you, your coworkers, your employees, are experiencing burnout, are exhibiting signs of approaching that, and figuring out some of the ways that you can tackle that through some of these prevention tools that we've identified here. And then above all, as I said, be genuine. And it really is important to, at this point, just be human. Make sure that you are modeling the behaviors that will help prevent burnout. Make sure that you are taking your health seriously. So putting in healthy habits, making sure that you're taking care of yourself, self-care, and being consistent. So if you don't walk the walk, then how can you expect that when you try to encourage others to do the same, that they will actually believe that it's true? So a mentally healthy workplace really does require effort on every level. And then finally, I would just say, emphasizing the importance of self-care and taking care of yourself, and kind of creating a workspace that promotes that. And I can tell you a little bit about how we do that at the Mental Health Foundation of Nova Scotia. So through one of our professional development sessions, we we created our own agreements. And so those are really just kind of rules that we live by within our workplace, and just when we're working with one another. And it's really important for us to, at the Mental Health Foundation of Nova Scotia, practice what we preach, because if we're not living and working in a way that benefits our mental health, how can we speak with you and others and encourage them to do the same? So these are kind of the rules that we live by. Being bold means not being afraid to speak up and speak out regarding either your personal or professional matters. Practicing self-care can mean taking a lunch break and getting in some exercise, going to the gym or yoga. Maybe you're somebody that, listening to music really calms you down. Working from home as needed, or going to the office if you're able. Socializing with friends, and, making sure that you're using your sick days. At the foundation, we have quarterly mental health days, and those are not days that you take because you're experiencing mental health problems. Those are days that you take to proactively improve your mental health. So, for example, on my mental health days, I've slept in, I have young kids, so having the luxury of being able to just relax, get some chores done. I've spent time with my mother, gone to yoga, those sort of things, like all these things that really kind of fill you up and, make you feel better. And it's really, these are all things that are really just leading a healthy lifestyle. Put it on the table means being upfront. So if something's bothering you at home or at work, if you put it on the table, then your colleagues can help address it. And it's kind of like an informal list that we have here that really promotes an inclusive and safe environment. So the bottom two ones are pretty straightforward. All voices equal, practice listening. Those sort of things really make people more comfortable sharing how they're feeling. So if they're seeing those signs of burnout, if they're experiencing mental illness, then they're comfortable approaching you and talking to you or their fellow colleagues. So it does sound simple, but it's really all about just being kind and empathetic and caring to your coworkers, to everyone that works in your industry. And if you are somebody in a management position, adjusting your expectations for your staff and really fine-tuning a schedule that works for them. Again, I know this is probably something that's super challenging with seasonal workers, but the more that you can kind of operate as a family unit and really respect one another and care about each other's health, the happier and healthier everybody will be. So without further ado, I think that's about it. I'm going to take and the other thing I wanted to say too was if you are looking for resources to provide to your staff or colleagues, because I know everybody sort of has different jobs and positions, please don't hesitate to reach out, because we do have a number of I call them partner organizations, but they're those organizations that are service providers that we provide funding to run their programs. And they really are community-based, and they're from one end of the province to the other. So if you are looking for resources for yourself or for your staff members, I can definitely provide you with sort of like a tailored list to whatever part of the province that you're living in. Again, thank you for having me.
Yeah, well, thank you so much for joining us, Jill. I know this subject is a little bit unconventional for what we tend to do with our webinars, but I think it was definitely worthwhile. And even just having this resource kind of in the back of our pocket in the future is going to go a long way for the industry. So thank you so much for joining us and tailoring a presentation that was a little bit different for you, but you did a phenomenal job. We're really happy to have you.
Thanks, Jay. Thanks, everybody. Really appreciate you tuning in.
I just wanted to mention before you all head off that going into April, we are going to start looking at more technical discussion. So our April session will be the last Tuesday of that month over the noon hour again, and we are going to be looking at identify weeds in Christmas tree lots and forestry. So if you've got a weed that you're not sure what it is, bring it in and hold it up to the screen and we'll figure it out. So thanks very much.